Welcome to my channel. Today I'm going to be talking on a very amazing part of our body that plays a very vital role during birthing, and that is the pelvis. Now, understanding its anatomy and functions can empower you through this incredible journey of pregnancy. The pelvis is a ring-like bony structure which is actually located at the base of your spine, right? You see that? It has three main bones: the hip bone, the sacral, and the coccyx. All of this work together to carry the weight of your upper body, and it also provides balance and stability. Now, if there's one way I'd like to describe this, I'll call it as the central. Let's get to the question. Why is the pelvis important for childbirth? It is so important because during labor, the baby has to move through the pelvis to make their grand entrance into this world. And so, because of its unique ability to adapt and allow this passage, thanks to the hormone called relaxin, which looses the ligament and the joints in the pelvis. And this is the reason why it is very easy for your baby to pass through. Now, the pelvis is divided into two parts: the false and the true part of the pelvis. Now, the false part of the pelvis is the upper part, which we're not really going to go into today, but the lower part plays a very vital role during childbirth. It's sort of shaped like a canal, a place that which the baby would just go into a canal. Imagine that passing through, making this ground rising into this world. Like every part of our body, the pelvis also faces some challenges. One of the most common issues I hear all the time is the pelvis girdle pain. This actually affects 1 in every 5 pregnant women that I have met. And this pain actually comes due to the increase of the weight as your baby is growing by the day. So it's actually not a pain that you call negative. It's actually a good thing because you know something is happening in there. Things I tell women to do during this time if they have such pain is do some exercises, have some ropes, something to pull to support yourself. This can actually relieve you of that kind of pain or discomfort. Now, another concern that I often hear is the pelvis floor dysfunction. Your pelvis floor muscles support your bladder, your bowel, and your uterus. Now, one of the things about pregnancy is that during pregnancy and childbirth, these muscles can actually be weakened. And so therefore, when these are weakened, you hear things like incontinence or prolapse. But you know, very funny is simple pelvis floor exercises like Hegel can actually strengthen these muscles or even alleviate the problem. When you have a better understanding of the anatomy and the function of your pelvis, this makes a big difference. Now, during labor, remember, the baby has to move through the pelvis like that, and makes its grand entrance into this world. Therefore, the pelvis plays a very unique role. It is not a vehicle, but it is a portal. And one thing that I really like to make women understand is that the pelvis is one bone that actually has the ability to adapt to open this passage. And this is a very important part during childbirth because it actually moves when a woman is moving her body as well. Understanding the anatomy and function of your pelvis can make a huge difference on the way you approach childbirth as well as your postpartum recovery. So now we know, take care of your pelvis, stay informed, and of course consult your healthcare provider if there are any concerns with your pelvis. Believe me, ma'am, I trust you and I know you're doing a very good job. And thank you for joining me today. And if you have found this video useful to you, do not forget to subscribe. Tim Beloved is my name. If you like it, follow me for more.